my name is Sarah Correll and I'm a physical therapist at Breakthrough PT here in Sunnyvale, and today we're going to be talking about IT band syndrome. IT band syndrome is a common overuse injury in runners, and it's often due to a compression or a friction between the IT band and the lateral femoral condyle. Symptoms of IT band syndrome often include pain on the outside of the knee in runners that are increasing their mileage or athletes that play a sport that requires a lot of running. There's a couple different ways we can release the IT band, and we're going to show you those right now. Our first technique is an IT band rollout, and I'm going to have Amber here show you guys what we want to achieve with this. So what we're going to have her do is roll from the very top of her knee to the bottom of her hip. So go ahead and start that, Amber. And the goal of this exercise is to change the perception of tightness in the IT band, and this often leads to a feeling of a release. This is also not the most comfortable intervention, but it works pretty efficiently. So Amber's trying to go from the bottom of her hip to the top of her knee, and she's rolling forward and backwards so she gets the front of the IT band as well as the back of the IT band. So I would recommend that Amber do this for about 15 repetitions, and she would want to do it on both sides if she's experiencing symptoms on both the right and the left. Our second technique is an IT band stretch, and Amber's going to help us out with this too. So she's going to hook her left leg in front of her right leg because she's experiencing symptoms on the left outside of her knee. And once she hooks that leg, she's just going to lean over towards me to get a stretch along the whole lateral line of her body right here. Unlike our first two interventions that are compressive in nature for IT band syndrome, MFD uses negative pressure to decompress the tissue layers so that they can glide and slide past each other more efficiently. So today on Amber, we're going to show you an IT band release using MFD. This one is going directly over the IT band on that area where it hurts to foam roll the most. That's the point of the most densification of the tissue. You can see here that we're lifting up the tissue layers so that they can glide and slide better. With tilting her pelvis forward, we're going to bring her back into hip extension and hip adduction. So we're getting a really good stretch in that IT band and allowing the tissue layers to glide and slide. And then after we do the release, we're going to pop the cups off of her just like this. Roll this in. And following this kind of treatment, you will have some marks on the area that was treated. As you can see here, Amber has a couple of little spots. It's important to be evaluated by a physical therapist so that we can correctly assess you for IT band syndrome and then implement these exercises so that you can return to running pain-free. So come on in and see us.